What have you seen in the field of therapy and clinical psychology in terms of anti-white bias?
I mean, I think like just to stick on this issue, I think it's like really stunning that it's bias and aggression directed at white people is so systematically excluded as a clinical concern. It's like the way that it often gets framed is that aggression against white people isn't racism. And the reason why they seem to want to make that argument is to say that it's less important or unimportant, or maybe even okay, or maybe a good thing even. I think there are people in the field who would argue that anti-white racial aggression is good or needed or something. But I think the biggest thing that just strikes me is just like there's no services, there's no resources, there's no trainings, and there's no literature. I think if people could really just hear case studies of what people actually experience and how it impacts them, we need data and we need to tell those stories. I think it would really actually have a profound impact on the culture if we could actually do that research and tell those stories. It's very hard to find faculty that are willing to do that, but that's the biggest thing. And if you experience it and you go find a therapist at random, the chance that that therapist thinks, well, you're privileged, so it's not really racism when you, it's like, it's not negligible. Maybe it's depending on where you live, it's a majority or not a majority of therapists, but it's not a negligible percentage that could actually compound the issue by stigmatizing you. I mean, it's crazy that people experience this and then describing what happened to them. They're afraid to talk about what happened to them because they'll get attacked for it. It's just totally obviously unhealthy and obviously immoral. Like, I think racial aggression towards everyone is wrong. It's deeply believed. I think that's a sacred truth. It's stunning to me that there's this form of racial aggression that we can't say that about. And I think that's really the root of a brokenness around ethics, around reality, around emotion regulation. And I think it's really spreading a lot of the chaos that some of which seems unrelated. But I think it's just kind of rippling out.
It's like so much of it seems like it's some mission to right a historical wrong. Like this one-on-one relationship we have in the therapy office can never accomplish its goal of helping someone with their mental health until we first address this issue of white privilege or decentering whiteness.